If you're an African American man over 50, this information is particularly crucial for you. Could hidden issues with vitamin D be contributing to prostate enlargement or even prostate cancer? Today, we'll delve into the essential facts about vitamin D, actually a hormone, and its relationship with prostate health. We'll explore its role in prostate enlargement, the proper supplementation dosage, who needs it, the potential risks, and what happens when vitamin D levels are too low or excessively high. Vitamin D has been thrust into the spotlight for its possible role in preventing and treating cancer. Traditionally recognized for supporting bone health, new research hints at its potential anti-cancer effects. However, it's important to note that the evidence isn't definitive yet, and scientists are still investigating this intriguing connection. The idea that vitamin D might combat cancer arises from its role in key cellular functions like regulating cell growth, initiating apoptosis, the programmed death of cells, and promoting differentiation. These processes are vital for preventing the unchecked cell proliferation that leads to cancer. The active form of vitamin D, known as calcitriol, binds to vitamin D receptors, VDRs, found in various tissues such as the colon, breast, and prostate. This interaction can influence gene expression and may inhibit tumor development. Beyond fortifying bones, vitamin D is a key player in multiple aspects of our health, notably in bolstering the immune system. Adequate vitamin D levels enhance the body's ability to fend off infections, including urinary tract infections, UTIs. It supports urinary tract health by boosting the production of antimicrobial peptides, natural substances that combat bacteria, viruses, and fungi. These peptides serve as a frontline defense, directly attacking and neutralizing harmful microbes that could cause UTIs. When your vitamin D is sufficient, your body is better prepared to prevent the bacteria that commonly lead to these infections. But there's more. Vitamin D also aids in absorbing calcium into your bones, essential for maintaining bone density and preventing conditions like osteoporosis. In addition to bone and immune health, vitamin D significantly influences cardiovascular well-being. It aids in preventing heart disease by regulating blood pressure and supporting heart function. Moreover, vitamin D is involved in insulin regulation, playing a role in blood sugar control, which could be beneficial in managing or preventing diabetes. Despite being accessible through sunlight, diet, and supplements, vitamin D deficiency is a global concern affecting millions. The deficiency is especially prevalent in regions with limited sunlight during winter or among people who spend most of their time indoors. Factors such as darker skin pigmentation, aging, and certain dietary habits can also hinder the body's ability to produce or absorb sufficient vitamin D. African Americans are at a higher risk of vitamin D deficiency, largely because increased melanin levels in darker skin reduce the skin's ability to synthesize vitamin D from sunlight. Melanin acts as a natural sunscreen, protecting against harmful UV rays, but also limiting vitamin D production. Therefore, the darker the skin, the less vitamin D is produced during sun exposure. Low magnesium levels are another factor that can impede proper vitamin D absorption in the body. Magnesium is vital for numerous bodily functions, particularly concerning vitamin D. Involved in over 300 enzymatic reactions, magnesium is essential for metabolizing and activating vitamin D. When you obtain vitamin D from sunlight, food, or supplements, it initially exists in an inactive form. Magnesium facilitates its conversion into an active form that the body can utilize. In the kidneys, magnesium assists in converting inactive vitamin D into its active form, making it usable by the body. Additionally, it regulates vitamin D receptors throughout the body, which are crucial for absorbing and utilizing vitamin D. Without sufficient magnesium, these receptors may not function optimally, hindering the benefits of vitamin D even if you're consuming enough. Thus, magnesium is an indispensable partner to vitamin D, ensuring it effectively supports your health. How does vitamin D affect prostate enlargement? Insufficient vitamin D levels have been associated with a higher risk of prostate enlargement or benign prostatic hyperplasia, BPH, and possibly prostate cancer. Vitamin D is involved in regulating cell growth and differentiation, essential for maintaining healthy tissues like the prostate. When vitamin D is lacking, these regulatory processes may falter, leading to uncontrolled cell proliferation, a key characteristic of BPH and cancer. Vitamin D specifically affects the expression of genes related to inflammation and immune responses, both crucial to prostate health. Inflammation contributes significantly to prostate enlargement by causing the gland to swell. Vitamin D's anti-inflammatory properties can help mitigate this, potentially reducing the risk of BPH. Moreover, inadequate vitamin D can impair the immune system's capacity to identify and eliminate abnormal prostate cells, increasing the chance of these cells multiplying into tumors. Studies indicate that men with lower vitamin D levels may face a higher risk of developing aggressive prostate cancer. Therefore, maintaining sufficient vitamin D is vital not just for overall health, but also for potentially safeguarding against prostate enlargement and cancer. What is the appropriate dosage for vitamin D supplementation? Determining the right vitamin D dosage isn't straightforward. It depends on factors like age, location, skin type, and overall health. Generally, adults are advised to take between 1,000 to 2,000 international units (IU) of vitamin D daily. However, this amount may not suffice for everyone. Individuals with deficiencies or health issues affecting vitamin D absorption, such as prostate cancer or certain infections, might need higher doses. However, there's a caveat. Excessive vitamin D can be detrimental. Overconsumption may cause hypercalcemia, an excess of calcium in the blood, leading to symptoms like nausea, vomiting, weakness, and dizziness. In severe cases, it can result in kidney stones or heart issues. Therefore, it's crucial to consult a healthcare professional to determine the appropriate dosage for your needs. Additionally, since vitamin D is fat-soluble, it's best absorbed when taken with a meal rich in fats. Is vitamin D supplementation necessary for everyone? While not everyone requires vitamin D supplements, many could benefit, particularly those at risk of deficiency. This group includes people living in regions with limited sunlight, individuals with darker skin, older adults, and those with conditions affecting nutrient absorption like Crohn's disease or celiac disease. People who spend most of their time indoors due to work or lifestyle may also need supplementation. However, it's advisable to check your vitamin D levels through a blood test before beginning any supplementation. This approach allows you to customize your intake and avoid the risks of both deficiency and excess. Feel free to share your thoughts and experiences in the comments below. Don't forget to like, share, and subscribe. Thank you.